Welcome to Cleveland Clinic Children's Hospital for Rehabilitation. We are honored that you have chosen Cleveland Clinic to care for your child. Our goal is to teach children the skills they need to fully participate in the world when they leave the hospital. We know that this can be a scary time for you and your child. This video is designed to provide you with important information about the rehabilitation team that will be taking care of your child and what you and your child should expect from the hospital stay. We will also be advising you on what to do when your child is ready to be discharged from the hospital to go home. Your child will be seen by several members of the rehabilitation team. Depending on his or her needs, the team may include the medical team, the nursing team, patient care managers, psychologists, social workers, educators, therapists, and other specialists. The medical team works together to determine your child's needs and develop care plans for rehabilitation. Physiatrists, who are also known as rehabilitation specialists, will oversee your child's care, including therapies, medications, and any alternative therapies that might be needed. Nurse practitioners will help coordinate your child's care between the medical team, which also includes pediatricians and residents and other caregivers. The medical team will go on rounds each morning with all members of the rehabilitation team. You are encouraged to attend and ask questions at any time during your child's stay. The nursing team carefully observes the patient and updates the medical team as needed. Your child's nursing team is made up of registered nurses, licensed practical nurses, and nursing assistants. Nurses provide daily care to the patient, including giving medications, changing the patient's dressing, and helping the patient with bathing, eating, and going to the bathroom. Nurses work closely with the patient's family to provide education and updates on the patient's condition. Patient care managers are registered nurses who work on admissions and discharge planning and also help with insurance questions. Psychologists provide emotional support to the child and family in the process of rehabilitation. They address adjustment to illness or injury, coping skills, behavioral supports, and planning for transition to home, school, and community environments. Social workers act as an advocate and provide support to the patient and family members throughout the hospital stay. Social workers connect the family to community resources and help coordinate the child's discharge plan. Educators are Cleveland Metropolitan School District teachers who are licensed in grades kindergarten through 12. They will provide services for children in both regular education and special education throughout the hospital stay. The teachers will work closely with both the parents and the student school district to complete schoolwork provided by their school. The educators will also work with the rehabilitation team on the school reentry process. Your child may be seen by different therapists while he or she is in the hospital. These therapists may include physical therapists, occupational therapists, speech-language pathologists, recreational therapists, and respiratory therapists. Physical therapists focus on improving the child's mobility or ability to move, including walking, transfers, and bed mobility. By focusing on regaining strength, balance, and coordination, the child can work on walking or finding other means of mobility. Physical therapists also help adapt equipment to improve a child's movements. Occupational therapists focus on helping the patient regain as much strength and endurance as possible. Occupational therapists help the patient relearn life skills such as dressing, grooming, eating, bathing, and going to the bathroom. Occupational therapists will also help the patient with coordination and fine motor skills, such as picking up a pen or a fork. Speech-language pathologists work with the child and family in the areas of feeding, swallowing, communication, and cognitive functioning, including difficulty speaking and/or understanding language, attention, memory, and problem solving. Recreational therapists work with inpatients to create structured activities that focus on coping, leisure education, social interaction, and activities of daily living. Recreational therapy focuses on community re-entry skills, decreasing agitation, and increasing communication skills. Inpatients may also take part in group activities with recreational therapy throughout the hospital stay. Respiratory therapists work with children who need medications, treatments, or special equipment to manage breathing problems. They also work with the parents to help them deal with the child's breathing needs at home. Your child's treatment at Cleveland Clinic Children's Hospital for Rehabilitation will be designed especially for him or her based on evaluations and recommendations by the caregivers. Patients usually have at least 3 hours of combined physical, occupational, and speech therapy a day, 6 days a week. In addition, they may receive recreation, music, art, and pet therapy, and may have other activities that are designed to help them recover. Your child's progress through rehabilitation will be evaluated on a weekly basis. How well your child does in rehabilitation will help determine when he or she can be discharged home. As part of the discharge plan, we will also take into account your child's needs when he or she gets home. This is what a typical weekday looks like at Cleveland Clinic Children's Hospital for Rehabilitation. Your child's schedule may be different depending on his or her medical condition, therapy sessions, clinic appointments, and so on. When it's time for your child to be discharged from the hospital and go home, there are certain preparations that have to be made. Here's what will happen before your child goes home. The rehabilitation team may make a home visit before your child goes home. During a visit to the child's home, a social worker and/or therapist makes sure the environment is safe for the child. They will also make recommendations for any changes that need to be made, including ramps or adjustments to the bathroom. The rehabilitation team can make arrangements for any medical equipment your child may need at home, including rental wheelchairs, feeding supplies, or respiratory equipment. This is a written plan that you will receive that tells you how your child's care will be continued once he or she goes home from the hospital. Before your child is discharged, the medical team will double-check his or her medications to make sure they are correct. The need for a community reentry trip is determined on a case-by-case basis, depending on the child's needs and the team's recommendations. This trip will occur before the child is discharged. Another important consideration when your child comes home from the hospital is preparing for when he or she will be going back to school. We will help make the return to school as smooth as possible in the following ways. We will meet with you to discuss your child's return to school. We will contact your child's school to inform the teacher and principal that your child will be coming back soon. We will also get a copy of your child's individual education plan and any schoolwork that the child can do at home. When it's time for your child to go back to school, the rehabilitation team will meet with you and the school administrators to discuss the reentry and answer any questions about your child's condition. Your child's care and well-being are extremely important to us. We hope this video has answered your questions and given you an idea of what to expect when your child is in the hospital. Thank you again for choosing Cleveland Clinic Children's Hospital for rehabilitation.